Imagine your heart whispering to you subtle signs, quiet signals, almost too easy to ignore. Yet, many of us do just that, dismissing them as nothing more than minor discomforts or normal aging. But what if those small, unassuming moments are your heart's way of telling you that something deeper is wrong? In today's video, we'll uncover 12 unusual and often overlooked signs that could indicate your heart is in danger. These aren't the typical chest pains or shortness of breath we've all heard about. No, these are the signs that might be hiding in plain sight, silently warning you about cardiovascular issues. Stay with us, because by the end of this video, you might find that the key to protecting your heart lies in recognizing the most unexpected of clues. 1. Calf swelling or pain, a warning sign of circulatory issues. We often dismiss pain or swelling in the calves as a minor discomfort from exercise or prolonged walking. However, this could be an early warning sign of peripheral artery disease, PAD. A condition where arteries in the legs become narrowed or blocked, reducing blood flow and increasing the risk of serious heart complications. According to the American Heart Association, PAD affects millions of people and significantly raises the risk of heart attacks and strokes if left untreated. Dr. Robert M. Rose, a renowned cardiovascular researcher, emphasizes that PAD is often a sign of systemic atherosclerosis, meaning if arteries in the legs are clogged, it's likely the heart's arteries are also compromised. Early detection is key. A patient of mine ignored persistent calf pain until a routine checkup revealed severe arterial narrowing. With timely intervention, exercise, a heart-healthy diet, and medical treatments like angioplasty, the damage was controlled before it led to a fatal heart event. If you experience unexplained calf pain, especially when walking, don't brush it off. It could be your body's way of signaling an underlying cardiovascular problem. 2. Erectile dysfunction, ED, the heart and blood flow connection. Erectile dysfunction, ED, is often treated as a standalone sexual health issue. But Dr. Vallabhan Jeevanandam, a leading cardiovascular surgeon, highlights that ED can be one of the first indicators of heart disease. The reason? Both conditions stem from poor blood circulation. Studies in the Journal of the American College of Cardiology show that men with ED are at twice the risk of developing heart disease. This happens because the same process that narrows coronary arteries and leads to heart attacks also affects the small blood vessels supplying the genitals. One of my patients dismissed his ED as stress-related, but after further testing, we discovered early-stage coronary artery disease. Within months, lifestyle modifications and medical management prevented his condition from escalating into a heart attack. If you experience persistent ED, don't ignore it. Instead of treating it as just a sexual issue, consult a cardiologist to check for underlying heart disease. 3. Gum disease and bleeding gums, the mouth-heart connection. Surprisingly, your oral health plays a crucial role in cardiovascular health. Inflamed gums and frequent bleeding can indicate an increased risk of heart disease. Research published by the American Heart Association confirms that periodontitis, advanced gum disease, is linked to an increased risk of heart attacks and strokes. Bacteria from infected gums enter the bloodstream, triggering inflammation that contributes to plaque buildup in the arteries, atherosclerosis. I've had patients who neglected their dental health and later discovered their arteries were dangerously clogged. One patient in particular, who had avoided dental visits for years, was diagnosed with severe coronary artery disease. His gum inflammation had worsened his cardiovascular condition. Brushing, flossing, and regular dental checkups are just about fresh breath. They might protect your heart as well. If your gums bleed frequently, consider getting a cardiovascular assessment alongside your dental checkup. For loud snoring and sleep apnea, the heart's silent warning. If you or a loved one snores loudly, gasps for air, or stops breathing momentarily while asleep, it may not just be a sleep problem, it could be putting your heart at risk. Studies from Harvard Medical School show that sleep apnea reduces oxygen levels, forcing the heart to work harder and increasing the risk of high blood pressure, arrhythmias, heart attacks, and strokes. One patient of mine had severe sleep apnea but ignored it for years, assuming it was harmless. Only after suffering a heart attack did he learn how much strain sleep apnea had placed on his cardiovascular system. If you or someone you know snores excessively, wakes up gasping for air, or feels exhausted despite a full night's sleep, seek medical evaluation immediately. CPAP machines, weight management, and sleep therapy can significantly reduce cardiovascular risks. 5. Extreme fatigue. When your heart is crying for help. Fatigue is normal after a long day, but when exhaustion becomes overwhelming and unexplainable, it could be a warning sign of heart failure. According to Dr. Vallabhan Jeevanandam, chronic fatigue can indicate that the heart isn't pumping efficiently, depriving muscles and organs of oxygen-rich blood. The American Heart Association states that persistent fatigue, especially when paired with shortness of breath or dizziness, is often one of the earliest warning signs of an impending heart attack. One patient, a previously healthy middle-aged man, ignored his extreme fatigue until he suffered a heart attack. If he had sought medical attention sooner, he could have prevented severe heart damage. Don't ignore sudden or chronic exhaustion, it could be your heart struggling to keep up. 6. Skin changes, an unexpected indicator of heart disease. Your skin isn't just about appearance, it can reflect underlying heart health. Conditions like eczema and psoriasis have been linked to increased risks of heart disease due to chronic inflammation that promotes plaque buildup in arteries. Studies from the American Journal of Cardiology confirm patients with inflammatory skin conditions are more prone to developing cardiovascular problems. I recall a patient who suffered from persistent rashes. He dismissed them as minor dermatological issues until blood tests revealed high cholesterol and atherosclerosis. His skin had been warning him about his heart long before any classic cardiac symptoms appeared. If you noticed sudden or chronic skin changes, consult both a dermatologist and a cardiologist to rule out any hidden heart risks. 7. Unexplained nausea or indigestion, a surprising indicator of heart trouble. When people experience nausea or indigestion, they often assume it's a gastrointestinal issue. However, Dr. Ramdandelaya early warning signs of a heart attack, particularly in women. Studies from the American Heart Association, AHA, show that women frequently experience less typical heart attack symptoms than men, such as nausea, dizziness, and discomfort in the stomach area, rather than the expected chest pain. When the heart struggles to pump blood efficiently, it affects the oxygen supply to all organs, including the digestive system, leading to bloating, nausea, and discomfort that is not related to food intake or stomach conditions. Many patients initially visit gastroenterologists, assuming they have acid reflux or an ulcer, only to discover later, sometimes too late, that the real issue is heart disease. I once had a middle-aged female patient who ignored persistent nausea, assuming it was a minor stomach issue. She took antacids, but her symptoms did not improve. When she finally went to the hospital, tests revealed she was in the middle of a silent heart attack. Had she waited any longer, the damage could have been irreversible. If you experience unexplained nausea or indigestion, especially alongside fatigue, shortness of breath, or chest discomfort, do not dismiss it. Your heart may be trying to send you a warning. Seeking immediate medical attention could save your life. 8. Prolonged hoarseness, when your voice becomes a warning sign for your heart. A persistent hoarse voice without any signs of a cold or infection might seem insignificant. But Dr. Roger Blumenthal, director of the Johns Hopkins Cicerone Center for the Prevention of Cardiovascular Disease, highlights that it could be linked to heart failure. Heart failure happens when the heart cannot pump blood efficiently, leading to fluid buildup in the lungs. This excess fluid pressures the vocal cords, causing chronic hoarseness. Many people assume their voice changes due to allergies or overuse, but it could be a subtle indicator of cardiovascular problems. A patient of mine in his 50s ignored his hoarseness for months, thinking it was from speaking too much at work. However, when he started experiencing fatigue and shortness of breath, he sought medical attention. Tests revealed he had congestive heart failure, where the heart's weakened ability to pump blood led to fluid accumulation in the lungs, affecting his voice. If your hoarseness lasts for weeks without an obvious cause, and you also experience swelling, fatigue, or difficulty breathing, consider a heart evaluation. Early detection and treatment can significantly improve heart health and prevent complications. 9. Fainting or dizziness, a sign of poor blood circulation and heart risk. Fainting occasionally isn't always serious, but when it happens frequently or suddenly without explanation, it can be a red flag for cardiovascular disease. According to research from Dr. Ram Dandalaya, fainting often occurs when blood flow to the brain is reduced due to heart rhythm abnormalities, arrhythmias, low blood pressure, or arterial blockages. The AHA warns that repeated fainting can indicate heart conditions such as arrhythmias, valve disorders, or even early-stage heart failure. I once treated a 35-year-old man who collapsed while jogging. He was in excellent shape, had no prior health issues, and assumed he had just overexerted himself. However, tests revealed he had an undiagnosed arrhythmia, a condition that if untreated could have led to sudden cardiac arrest. If you have frequent unexplained dizziness, fainting spells, or lightheadedness, particularly during exercise, get a heart evaluation immediately. These symptoms could be your heart struggling to maintain proper circulation, and early detection could be life-saving. 10. Excessive sweating, your body's alarm for a heart problem. Sweating is a normal body function, but sudden, unexplained excessive sweating can be a serious cardiovascular warning. Dr. Roger Blumenthal explains that when the heart is under extreme stress, it activates the autonomic nervous system, triggering excessive sweating as the body tries to cool itself down in response to the cardiovascular distress. One of my patients came to my clinic, drenched in sweat, convinced he had the flu or a hot flash. However, after further evaluation, we discovered he was showing early signs of a heart attack. The AHA warns that cold, clammy sweats, especially if they occur alongside chest discomfort, dizziness, or nausea, may signal a heart attack. If you start sweating profusely without physical exertion, take it seriously and seek medical help immediately. 11. Anxiety, stress, and panic attacks, the hidden connection between mental and heart health. We often separate mental health from physical health, but Dr. Ram Dandalaya emphasizes that chronic stress and anxiety increase heart disease risks. Studies show that people with chronic anxiety and panic attacks are more likely to experience high blood pressure, irregular heartbeats, and inflammation, all of which contribute to heart disease. The AHA reports that individuals with anxiety disorders are at a significantly higher risk of cardiovascular events due to prolonged exposure to stress hormones like cortisol and adrenaline. One of my patients suffered from frequent panic attacks and assumed they were purely psychological. However, after experiencing high blood pressure and irregular heartbeats, he realized his emotional stress was directly impacting his cardiovascular system. Managing stress through meditation, therapy, exercise, and proper sleep can reduce both anxiety and heart risks. Prioritizing mental well-being is just as critical as monitoring cholesterol and blood pressure. 12. Decreased exercise tolerance, when your body can no longer keep up. If you suddenly find yourself struggling with activities that used to be easy, such as climbing stairs or jogging, this could be a sign of heart disease. Dr. Roger Blumenthal explains that reduced exercise tolerance is often an early symptom of heart failure. Because the heart cannot pump enough oxygenated blood to the muscles. This leads to fatigue, breathlessness, and muscle weakness. I treated a regular marathon runner who suddenly struggled with short jogs. At first, he assumed he was simply out of shape, but after persistent symptoms, he sought medical evaluation. Tests revealed early-stage coronary artery disease, which had it been ignored could have led to a heart attack. If you notice a sudden decline in your ability to exercise, especially if it's accompanied by chest pain, dizziness, or shortness of breath, consult a cardiologist immediately. This could be an early warning sign of blocked arteries or heart failure, and timely intervention could prevent serious complications. As we've explored today, these 12 warning signs ranging from calf pain and erectile dysfunction to excessive sweating and unexplained fatigue are more than just minor annoyances. They could be the first whispers of a much larger problem with your heart. Ignoring them could put your health at risk, potentially leading to life-threatening cardiovascular events. So, the most important takeaway? Don't wait for the dramatic heart attack or stroke to make you act. If you notice any of these signs, take them seriously and seek medical advice. Remember, heart health isn't just about what you can feel in your chest, it's about listening to your body and recognizing when it's asking for help. Take care of your heart today, so it can continue to take care of you tomorrow. Your heart deserves it.